I'm Dr. Robynne Chutkan, gastroenterologist, microbiome expert, and author, and I am here to help you find gut bliss. I want to help you understand what your digestive tract is trying to tell you when it's bloated, backed up, inflamed, gassy. Gut bliss isn't just the absence of those symptoms. It's a presence of physical and emotional well-being that starts in your gut. I want you to be comfortable talking about your bowel habits, your gas, what your stool looks like. That's all really valuable feedback that your body's giving you, and you need to understand it and be able to discuss it without embarrassment. And while you're at it, I want you to turn around and take a look, because it could save your life. A little blood in the stool, probably just hemorrhoids, but it could be colon cancer. Gas and diarrhea, maybe you're lactose intolerant, but it could be colitis or a parasite. You have a lot more control over your digestive health than you realize, and you definitely have a lot more control than what the medical industrial complex wants you to believe. Yes, unfortunately, some of us are dealt a bad hand genetically. That's a fact. But disease isn't something that just falls out of the sky into your lap. It's something that develops and progresses in a predictable way. And once you understand what those predictive factors are, you can usually change your outcome. I'm not saying you can always prevent disease, but you can almost always improve it. And that improvement often begins in your gut. Why? Because the trillions of organisms that live there have a huge impact on everything going on in your body, from your mental health to your heart health to your immune health. Your gut microbiome impacts your mood, your weight, how fast you age, whether you develop cancer. It is the most important medical frontier of the last century. And in this podcast, I'm going to be spending a lot of time talking about that microscopic zoo inside you and how you can harness the power of the microbiome to live healthier and longer. The Gutbliss podcast is brought to you by Visbiome, my first and quite frankly, my only choice for a probiotic. Whether you're dealing with irritable bowel syndrome or just looking to restore your gut health, Visbiome can help. It's a medical food for the dietary management of IBS and gut inflammation. Backed by science and clinically vetted by thousands of my own patients. Find your gut bliss with Visbiome. Go to visbiome.com/gutbliss and use discount code GUTBLISS at checkout. My personal interest in the microbiome began out of necessity about 20 years ago when I was pregnant with my daughter, Sydney. It's a story that started out bad, but it ended up good, and Sydney is now a healthy college student. But her experience is a true cautionary tale of what can happen when too many antibiotics are introduced at a young age. And for those of you who have children who've received a lot of antibiotics or who yourselves have taken one too many rounds, I'm here to help. I have advice that can get you back on a healthy path, as I was able to do for my daughter. So a little bit about me. I went to medical school at Columbia in New York and also did my internship, residency, and was chief resident there. I did my gastroenterology fellowship at Mount Sinai Hospital, also in New York. When I finished my training, I moved to Washington, D.C. and joined the faculty at Georgetown Hospital. In 2004, I opened my private practice, the Digestive Center for Wellness, where I focus a lot on diet, lifestyle, and optimizing the microbiome as part of my therapeutic approach to GI disorders. I'm the author of 4 books on gut health, Gutbliss, The Microbiome Solution, The Bloat Cure, and The Antiviral Gut. And you can find them wherever books are sold or on my website, gutbliss.com. There are a couple other things I want you to get out of this podcast besides understanding where your smelly gas comes from and how your digestive tract works. I want you to learn how to be a medical detective for your digestive system so you can figure out what's gone wrong and how to get it back on track. I want you to understand how to eat for optimal gut health. And I want to teach you how to engage with your healthcare provider in a dialogue rather than a monologue so that you can get the care you need, not what they think you need. So let me tell you about a couple of the episodes we have coming up. Shy bowel, otherwise known as parcopresis, the technical term for holding your stool in when you should be pushing it out. If you have a tendency to wait for the ideal bathroom situation to present itself, you need to hear about what can happen if you don't drop it while it's hot. Queen V. the advice your OBGYN never gave you for how to optimize your population of lactobacillus, the most important bacterial species in the vagina that can actually help prevent infertility, miscarriages, and sexually transmitted diseases. Potholes in the colon. If having a bowel movement has become your full-time job with multiple small pellet-sized poops that look like rabbit droppings, you may have diverticulosis, a condition that affects half the population over 50 in the US and lots of younger people too. I'll show you how to turn those pellets into logs. The gut first theory. What do Alzheimer's, long COVID, chronic fatigue syndrome, Parkinson's, autism, and MS have in common? They're all diseases that affect the brain but start in the gut. I'll break down the early GI warning signs and tell you exactly what you need to do to keep your gut and your brain healthy. Beauty and the bloat. Hair loss and skin issues are high on the list of problems I see as a gastroenterologist. That's because without healthy bowels, it's hard to have glowing skin or a full head of hair. I'll give you my essential tips for banishing bloat on the inside and creating a healthy glow on the outside. So that's just a sampling. I have lots of information to share with you, from groundbreaking microbiome research to how to deal with common GI disorders like heartburn and constipation, to all the latest on emerging conditions like SIBO and leaky gut. The Gutbliss podcast is your source for all things gut related. As a practicing physician for over 30 years, there are a couple things I know for sure. I know that we need to question the status quo when it comes to health, especially the need for pharmaceuticals. I know that nurture trumps nature. And what I mean by that is good habits can help you overcome bad genes. I know that Hippocrates was right a few thousand years ago when he said that all disease begins in the gut. And I know that the solutions to many diseases can also be found there. So you ready for some stool nirvana? Ready to banish your bloat? Ready for some gut bliss? Let's do it. Go to gutbliss.com for my free 7-day microbiome reboot course. If you like what you're hearing, drop a review and hit that subscribe button. And remember, dirt, sweat, vegetables, the best prescription for a healthy gut. Coming up next week on the Gutbliss podcast. She never told a soul what had happened. She never went back to camp, and she never had a normal bowel movement again.